Good afternoon and welcome to Parkinson's TV. My name is Dr. Jory Fleischer and I'm thrilled that you're joining us for this, our 6th episode on Parkinson's and speech. So for most people who don't have Parkinson's, we take speech for granted. Speech is sort of one of the most natural things for us. Having a conversation is easy. But for someone who has Parkinson's disease, that can be a lot more difficult and require a lot more thinking and a lot more effort for that to happen. So I'm joined today by our esteemed guests. First, I want to introduce Richard Simoni. He's been diagnosed with Parkinson's since 2010 and has also enjoyed being a patient advocate as well. So thank you so much for being here to share your story.
Thanks for having me.
And next to you is Karen Slotnick. Karen, you're a speech-language pathologist and the director of the Speech-Language Learning Center at Mount Sinai Beth Israel here in New York. And you're specialized in Parkinson's disease. So we're so thrilled to have you here to share your expertise on speech and how that can affect our patients.
Thank you so much.
And finally, to my right, our expert, Dr. Bas Bloem, who is professor of neurology at Radboud University in the Netherlands and founder of ParkinsonNet. Thank you so much for being here.
Excited to be here.
So as we get on in the episode, we will also take questions that have come from viewers like you towards the end. So if there's something in your mind that you're thinking about, hopefully we'll get to that. If not, you should send in questions as well. So I want to start with Karen. Can you explain a little bit about some of the common issues in terms of speech problems that can happen for people with Parkinson's disease?
Sure. Apparently, according to research, at least 90% of individuals with Parkinson's disease will develop communication disorders or difficulties in their future. And these take many forms. Primarily, the volume of the voice is diminished over time. And so individuals will have difficulty raising the level of their loudness. And family members will often say that they can't be heard or they'll ask them to repeat. Other parameters of vocal or speech or language production are altered as well. Very often the vocal quality will change so that patients will have a more breathy or rough or husky vocal quality or a weak vocal quality. The intonational patterns of speech will also diminish so that people will, instead of having the music and the highs and lows of their speech that are very expressive and express emotion and all kinds of particularities of what they're saying, will be diminished so that their speech will be very flat and monotone. Also, articulation, the clarity of individual sounds can be reduced, so the speech is harder to understand. And there are other factors that relate to language. Very often individuals take a longer time to formulate what they want to say, and they have difficulty retrieving the words that they want to express themselves. So that makes it very difficult to participate in the back and forth of a rapid fire conversation, and so that they often feel left out of conversations because they're not able to respond as rapidly. And one other factor that I'd like to mention is that we don't just communicate with words. We communicate with in other ways, including our facial expressions. And we know that down the road, many individuals with Parkinson's disease have reduced facial expression. And so it makes it appear as if they're not engaged or interested in what is going on around them or in conversation, but actually they are. So these are all different factors that affect their communication skills in a negative way.
I mean, it's quite a wide range of things. Richard, have you experienced any of these? How has speech changed for you?
I've only met this wonderful lady here today, but she was describing me and her symptoms. I have a bit of all of that, I think, and it's just sort of made itself present in the last 3 to 4 to 6 months.
Can you say a bit more? What specific things? Karen, you touched on a lot of different things, and people can experience all different flavors.
The loudness is a good part of that. Sometimes I'm not talking loud enough. Now, it's kind of interesting because my wife will be the one, as you were pointing out, that will say, could you repeat that? Now, what even makes it more difficult yet is she wears a hearing aid, and sometimes she doesn't have it in, so we're not sure who's at fault. Pitch, I think is a word I would use. I'm not sure if that's the right word. I sometimes slur a word or two, and formulating sentences and starting a sentence and sometimes not being able to finish it because I wasn't sure what I was going to say. I find once in a while creeping into my life. Yeah.
So it sounds like a lot of different ways that this is sort of affecting you.
Right.
Karen, what are the different types of speech therapy available? I mean, you named a lot of different symptoms, a lot of different arenas in which speech can be difficult. How do we address that?
Well, the gold standard for addressing these difficulties, particularly with speech and articulation, is LSVT, Lee Silverman Voice Therapy. And that's a very, very intensive form of voice therapy. During the course of therapy, we work very hard to exercise the vocal mechanism. We drive the phonatory system so that the individual is using increased effort to speak. And as a result, after continuous practice, we notice that the voice is stronger, that the articulation is better, because when you're using more effort to speak and to increase your vocal volume, that energy goes to your articulators as well, so your speech is clearer. We also see an improvement in vocal quality, and we also see an improvement often in facial expression because you're really working hard at it. But a very important part of this therapy is not just to improve the vocal system, but to teach the individual how to use their new voice. The mantra for LSVT is not be loud, but think loud. So I often bring in, I don't drive, but I bring in the metaphor of a car. If you bring a car into the garage and you have it tuned up, it can be in the best shape as possible, but still it needs a driver to make it go. So you have to be the active person to make your voice work. And that means you have to calibrate yourself so that you have to know how much energy you need to use in order to have a good voice. Maybe in your therapy they mentioned to you, what is the level of effort that you are using on a scale of 1 to 6? Or 1 to 10. And you may say, I'm using a level 6. So I may say, bring it up to a level 10. If you're not feeling that you're speaking too loudly, you're not speaking loudly enough. So another aspect is that there's a protocol where everyone goes home with assignments. They do their daily practice at home, which we mentioned. You also not only do your vocal exercises, but you have different areas where you may speak to your wife for 2 minutes using a louder voice, answering the phone in a louder voice, buying coffee at Starbucks, and then speaking to friends and being very conscious of using that extra level of energy to make your voice heard.
And so you mentioned this LSVT or Lee Silverman voice treatment. Is this something that's new, or is this something that's available to most people, or is this, is it kind of a specialty thing that our viewers will be able to find?
Well, this is something they can find providers through the LSVT Global website, and there are many practitioners across the United States. They are also providing this service. They're online through the internet. There is a program that they support called eLoud, and there are practitioners who can deliver the services. But it's true, not everyone can adhere to the rigorous protocol. It's 4 days a week for a period of a month. So there is standard speech and voice therapy that can be effective as well. But what's most important is this is a lifelong process, and once the individual learns the strategies, they need to practice it every day, just like you comb your hair and brush your teeth and do your other physical exercise, you have to do your vocal exercises. And I often relate it to professional singers. They have to warm up, they have to do their exercises every day. You're a professional, you need to get your voice as strong as possible.
So speaking of professionals, Boss, in terms of speech, people often think, okay, this is so pervasive and there's so many issues about speech that relate to Parkinson's. Can you diagnose Parkinson's just listening to someone speak?
There are many signs that can be the earliest manifestation of Parkinson's disease. I think speech oftentimes is among the early signs. I would say that in my career I've never diagnosed Parkinson's on speech alone, so I don't think it is that early of a sign. But what is really important about speech, and our speech and language pathologists in my hospital not only treat patients, but they also help me in the differential diagnosis, because the quality of the speech can tell you a little bit about whether it is Parkinson's disease or one of the lookalikes, which we call atypical Parkinsonism, diseases with complex names such as multiple system atrophy, MSA, or progressive supranuclear palsy, PSP. Their voice sounds different. It's also abnormal, but it sounds distinctly different. And not rarely, I send my patients to our speech and language pathologist, and they come back to me and they say, maybe you need to reconsider your diagnosis, because I hear a hint of slurring in the speech, which is more of a sign of cerebellar ataxia. You know, what happens when you drink too much alcohol, but now as a result of disease. And then I really need to go back to the drawing boards and reconsider my diagnosis. So it's an early sign, maybe not the earliest sign for Parkinson's disease, but it can be an early sign that it's something else other than Parkinson's disease.
I think that point is so well taken, because so many times people come, to the doctor, they get a diagnosis of Parkinson's disease, and eventually down the line that might change to one of these other related disorders. And it, it highlights the importance of having a speech language pathologist on the team who's listening from a different perspective and seeing things from a different perspective and going, wait. Maybe we're not totally on the right track. So constantly making sure that we have that right diagnosis. Karen, when should someone go to a speech therapist for Parkinson's disease?
I would say that they should go for an evaluation and for preliminary treatment as soon as they're diagnosed. It's never too early to get involved in a routine to maintain and to strengthen your voice and to get into that good practice of doing it, just as we said before, every day. And that will, we hope will, by doing that kind of practice, the same that you would do physical exercise, that it may not forestall or prevent, but it can definitely slow down the inevitability of any kind of deterioration in vocal production in the future.
Richard, when did you go to speech therapy, and how has that been helpful for you?
Well, I thought it was important to establish a baseline myself and ask for a referral to a speech therapist, which I knew the center had. And she was very very happy to have me, and she thought I did the right thing. I actually took the class for, I think it's a month, 4 days a week. You can be flexible with the days. They don't always have to be Monday through Thursday. It was easy to do. I think even the classes were less than an hour's time frame. As far as actually doing the routine, I don't think it takes me 5 minutes to do it. I don't know if that sounds about right. So what's 5 minutes a day? And quite frankly, as I mentioned to some other people earlier, I actually do it on the way to the gym. It's just one more exercise, one more item that I need to do. I turn the radio off, I go through this thing. Nobody else is disrupted because they're not in the car. Not that it's terrible to hear, but my wife will tolerate it around the house, sort of like singing in the shower.
Yeah, exactly.
So for our viewers who might not have a clear sense of like what does that actually sound like, do you mind sharing? Like, what are some of those speech exercises that you practice?
Well, let's see if I have it right. There's 4 steps to it. One step is just to sing, if that's the right word, a single note that's of high pitch for as long as you possibly can, with some volume, right? So that might sound like ah for as long as you can do that. And hopefully if you exercise regularly and so forth, that time gets longer and longer. Not that I can hold my breath underwater for a long time, but the next part is to do the similar thing with your voice, but to go up. So that might be ah, and you don't have to do that as long. I don't think it's an issue with holding it as long as you can, but you need to get there and hold it for some reasonable amount of time. And then the next thing is to go down. Ah, not difficult to do. Again, you don't have to stretch that one out too long. And you do each one of these 5 times in a row. So you do the single note, as long as you can hold it, 5 times. And then you go to the others. And then the next part is speaking sentences. So the therapist, when you're taking the class, will ask you to give 10 sentences that you might be apt to say every day. Like, what's for dinner, honey? And so that might be one of my 10, in fact it is. One of the, pardon?
You could already hear that you did that even better and louder because you practiced it so well.
I didn't know.
Didn't you hear
You
it?
get kind of hardwired for those
Exactly, it was
sentences, and they can
hardwired.
be your kind of benchmark for how you're going to improve.
Yeah.
So thinking up to 10 sentences, and then just pretty soon they become memorized in your brain. So I can do this, and you do that once. And then you repeat that a second time. In other words, the 5 voice items, 3 voice, 5 of the 3 voice and the sentence. You do that twice.
Got it.
And that's it every day. I mean,
That's it. That keeps
you
your
could
voice
do that
in shape.
while you're in the shower.
Yeah.
You can
So
do it.
Richard, have you been doing them every day?
No, honestly. The issue I have is finding the right place to do it so I'm not disruptive to people. For example, I didn't think it was fair to do that in my hotel room this morning, and I didn't think I would have gone into a separate room. They probably have a sound room here somewhere and practiced, but the session didn't, we need to get started.
But what I'd like to add is that periodically it doesn't hurt for people to come back to see someone for some tune-ups or for some encouragement to get back into the swing of things, because people do great right after the therapy, and then they'll come back a month later and then another month, and how are you doing? And then after a while, you know, things get a little less rigorous, and so it doesn't hurt to have a reminder and also practice to just make sure that you're doing it correctly,
You know,
getting you on track.
and something you said earlier got me to thinking, this is a perfect example of where telemedicine or using the internet for office calls is effective, because it's all done on the internet, on a computer. The therapist, while I'm doing this sessions for 4 weeks, is collecting the data and the recording. And I'm sure that she still has a file of my recordings that happened 4 years ago or 3 years ago. So getting this training over the internet, that should be a no-brainer, even if there's not pathologists everywhere. And in fact, you could almost say you could do this without a therapist, you know, at some level.
Well, after the initial training,
Right.
you can definitely do it independently.
Right.
And they also have something called the LSVT Companion, which is software that we use in the office. It helps us to track
Right.
the data, but there's also a version for the patient. You can have it at home and you can monitor. I think there's a screen that people look at. I don't know if you had that version when you were doing it 4 years ago. And you can actually see your sound pressure level, and you can get some external way of modifying your viewing and modifying your volume.
Right. Being a technologist, I know that all of these things with particular sound and volume and levels and so forth is easily determined and compared on the computer without any intervention. There's no reason why you couldn't get your baseline at the beginning, what you sounded like on your last session when you graduated, and it could be yours. And with some simple software, you could do this today and compare the two. And that's a no-brainer.
And it's a nice way of sort of instant gratification to see down the line that it's helping.
Right.
And it sounds, you know, Karen, I think your point is really well taken about it's great to start off seeing someone and then to come back as a booster. It almost reminds me of, you know, if you go to the gym and you're starting a new like weightlifting routine or something, you might see a trainer for a while, go off and do your own thing, but you want to come back and make sure that you have the right form, right? And that you're still sort of on track, or maybe you take it to the next level. So we've talked about all these different therapies. Bas, how long do the effects of speech therapy last?
Yeah, so that's one of the concerns. So it's not only an intensive program, but some people, critics of speech and language therapy, say, well, they do really well in the examination room with the therapist present, but they've forgotten to do the trick the moment they're out in the car park going back on their way home. So maintenance therapy is very critical. One of the factors that makes life extra difficult is that perception of voice is also disturbed in some patients with Parkinson's disease. So they don't perceive their own voice as being too soft. So not rarely it's the spouse who needs to keep alerting the patient that the voice is not loud enough. So the speech and language therapist in our center have now developed an app for the smartphone where you can see the quality of your voice as you're speaking. So you continuously track the quality of your voice. So we talked about the Lee Silverman voice treatment, which is an evidence-based and very good treatment. A variant is the pitch-limiting voice treatment. So one concern about Lee Silverman is when you speak loud, your pitch goes up, and that reduces the quality of your voice. So an alternative for complementary treatment is to lower your voice and speak loud. And that app gives you visually, on a circle on the screen, the height tells you how low your voice is, and the size is your sound. And it gives you continuous feedback. So you can track your quality of your own voice even while engaging in a conversation in a room. And of course, this needs to be now scientifically evaluated. But it's one of the developments that I think is going to bring speech and language therapy to the patient's home.
I think that's brilliant, and it also allows for some, personal sort of a sense of control. Of I see an immediate change.
It's control. Plus, you can set the targets individually. There, you need a speech and language therapist, and says this is your goals. This is within this range you need to speak, and then you can track that yourself.
That's tremendous. So we'll be excited to see the research and
We
results that come from that.
Yeah.
So, Karen, you brought along some other strategies. Can you tell us a little bit about these and how you
Yes.
use them for people with Parkinson's?
Yes, well, this one is a very interesting device that's fairly new, a couple of years old. It was developed at Purdue University, and it's called the Speech 5. And it's the research was based on the Lombard effect. We all know that if you speak with someone who's wearing headphones and listening to music, that you talk to them and they speak much louder because they're trying to overcome the sound in their ears. So this is something that is calibrated for each individual and delivers background noise into their ear when they speak and turns off when they stop speaking. And so it automatically, they speak louder. In most cases, they speak louder. For many people, it's a little distracting, but we notice that a lot of individuals with Parkinson's disease adapt to it very, very easily. And so they naturally speak louder. There's no cognitive load. There's no need to think about speaking louder. It just happens naturally. And then what they have found in some of their further research is that, of course, they speak louder when they have the device in, but when they use the device for a period of time, they've already trained their muscles, and they speak louder even without the device. So it's kind of interesting, and this is something we just started using. This actually was developed to help people with swallowing difficulties. But this is called the EMST 150, the Expiratory Muscle Strength Trainer. And this actually exercises and strengthens the expiratory muscles, which are involved in swallowing, enables strengthening of swallowing and coughing, but they've done some other research and they see that it also is helping to increase vocal volume. So it's something else that we're using with some of the patients. And this is just, this is a device. Think of it like a pair of glasses. It's a small voice amplifier. So very often, if an individual needs to increase their vocal volume, but they're in a group situation, in certain kind of situations, it can be very helpful. It's not therapy, it doesn't do anything to help the system, but it is something that helps in communication in certain settings.
Karen, I don't see it on the table, but I've had several patients where they might really have severe trouble, sort of more advanced Parkinson's. They may have a lot of hypophonia or really low voice, and they've tried a couple of these things. Do you ever use any technology, any apps? Do you ever, have sort of voice communication things on iPads or anything like that that you find useful for patients?
So instead of using their voice, communicating with a non. I haven't recently. No, I haven't had that opportunity. I've mostly been able to address
You can find a way
voice
with
through
these.
some other modality.
That's great.
I've definitely used it. I've got beautiful examples, even a lady well into her 80s who received an iPad for her 85th birthday from her grandchild. And it had this, you type your message and then it speaks out your message. And it's an N is one observation, it's a single case, but it really helped her to restore independence and communication. And I've definitely had other patients, particularly with atypical Parkinsonism, where the speech becomes very difficult more early on in the disease, where such iPad communication technology is helpful.
I just remember, as you said that, I did have a lady who was quite advanced. We did try the iPad, but because of her motoric difficulty and because the iPad is very sensitive, she wasn't able to use the keyboard. But we did just do a very low-tech program. She used to be a typist, and we got just an alphabet board, an alphabet sign in the QWERTY organization, and I gave her a pencil, and she was able to communicate that way. So yes, you really look for whatever. The most important thing is communication. So it doesn't always have to be verbal. You want to do it and find any kind of modality that will help.
Yeah. And I'll say anecdotally, I've had people where they struggle with hypophonia, but the grandkids are located somewhere far away, and so they're sort of used to using FaceTime or another video chat software, and having sort of the visual cue of someone sitting there and like watching and waiting and listening, sort of helps to remind them to speak up and speak louder and more clearly. So I think sometimes applications that aren't necessarily marketed as intentionally for speech. Fantastic. So each episode will answer some questions that have been sent in by our viewers. So let's take a look at the questions we have so far. So is it possible to start practicing my speech as prevention of having troubles speaking in the future? Karen, do you want to take?
Well, I think Richard did exactly that. As soon as he had his diagnosis, you had baseline evaluation, and you started doing vocal practice. So I think the earlier the better to start in that process.
Great.
Maybe I basically agree, but a small nuance maybe is that what I hear a lot about people with Parkinson's is, you've just heard you've got Parkinson's, and now they tell you, go see a dietitian, go see a physio, go see speech and language. And basically what you want to do is lead a full life. And not everybody wants a whole army of therapists right on early in the course of the disease. So my personal take is, sooner or later, everybody needs and deserves a speech and language therapist. I tend to reserve speech and language therapy for people where speaking is important and becomes impaired, either in the eyes of the patient or the spouse or other close ones. Because you don't want to overwhelm people with too many therapies early on. Yeah. And I do hear also complaints that we sometimes, in our enthusiasm to help people, overtreat them.
I think getting at that, another viewer wrote in, I think I still talk loudly, but the people around me tell me that I don't. What can I do? So where does that come from? Is that a trigger for you to say, okay, maybe now's the time to send someone? How do you approach that?
That's exactly one of the people I would definitely refer. It's more often the environment that begins to complain first than the patient, him or herself. I think the tool that you just showed is a useful one. The visual feedback could be a useful one. And again, it's the perception problem that is one of the reasons why patients are sometimes later in detecting the problems than the spouse or other close ones.
They often blame their family members. They're not listening, or they're hearing impaired, or they're deaf. Yeah.
A trick that I often use is, I ask my patients, has a telephone communication become difficult? Because people are very good at lip reading, and in a telephone conversation, of course, there's no visual feedback. So one of the earliest things that becomes impaired is the telephone. And when that's a problem, I refer them.
Right. So if someone's asking you to repeat yourself again on the telephone.
On the telephone.
That's a good sign.
Yeah.
Okay. So someone else wrote in, I never go to parties anymore because I can't be involved in conversations. People talk too fast and it makes me tired. How can I make sure people still understand and hear me while I'm in a crowded room? Richard, has this ever been a problem for you?
No, it hasn't. But I'm starting to be a little bit more concerned as my disease is progressing about something like that happening. I think it's very important for me, and actually probably for all Parkinson's patients, to continue to be social, to continue to interact with people. And you know, I think in some cases, their friends and families and whatever need to just accommodate them a bit as well.
Exactly.
Not to dismiss the problem, but just to make sure that they can communicate and still be part of the group.
Yeah, no, I think you beautifully said and illustrated the reasons why communication in a group where thinking is slower, finding the right words is slower, speech is too soft. And in all fairness, you know, you can't promise every patient that we will simply restore this. My solution would be is to just tell the other people in the party, I've got Parkinson's, it may be difficult. And if you want to have that full conversation, maybe step aside and do a one-on-one or bring down the music and give people more time.
And I think also you sort of hit on the education piece in terms of like the family and the caregiver, so that, you know, they understand that the person is wanting to communicate, right, and wants to be part of the conversation, but some accommodations sometimes need to be made, or at least sort of remember that the person is trying, but might not always remember to speak up because, you know, to a person with Parkinson's, it sounds like they're speaking quite loudly.
I think that very often I find myself in the position of being somewhat a marriage or a relationship counselor, because family members or children will think that the individual with Parkinson's is just not trying, is just not making the effort. And I say, you don't realize they're climbing Everest every day. They're doing something that's much harder than we will ever have to do. So you have to kind of cut them a little slack and be more patient. And I think that really helps. They need to be educated. The individual has to advocate for himself and speak to friends and close friends and explain the situation. Also, just a strategy in a noisy restaurant, which everyone has difficulty, is to sit a little closer to the person and have eye-to-eye and mouth-to-mouth contact, and that can help. But I think self-advocacy is the most important.
Well said, and I just want to totally echo that.
So speak up to speak up? Is that what I'm hearing?
But also the issue of counseling the environment. They're climbing the Mount Everest every day. They're not to blame for speaking softly, and if they forget the tricks they just learned with the speech therapist, it's not because they don't want to do it, it's the perception problem. So to counsel the environment in addition to treating the patient is a key factor.
It's a beautiful summary.
There's another factor here that comes to mind. Stress is a big problem for Parkinson's patients because it brings on the Parkinson's. In stressful situations, you act worse. Your disease is worse. So in a conversation situation, a party or whatever, this can deteriorate pretty quickly where the patient is having difficulty getting his communications. He feels sensitive about that, and he gets stressed. And now the problem gets worse. and you get into a feedback loop where it's easy enough to say, "Hun, let's go home."
Have you found strategies, if you've ever been in a situation like that, where you've been able to kind of de-stress or step back?
It's difficult to tell where stressors come in to the situation. Being here today in this audience, I'm starting to feel just a little bit stressed now, and I can tell that I'm slurring my words a little bit. My hand is starting to tremor too a little bit, if you excuse me. So I don't know about that.
I think you're doing perfect.
The placebo effect is also a big factor
That's
in
a big
Parkinson's.
factor, absolutely.
So,
But this
thank you.
It's a difficult thing to talk about, and to be able to articulate it so beautifully and sort of all of the ways that it's affected you is pretty remarkable.
It is.
All right. Well, so with that, that's our last viewer's question. So I want to wrap up our final episode of Parkinson's TV for now. And a huge thank you to you, our viewer, for being interested in making this possible. And a massive thank you to Richard for being here, to Karen, and to Boss. Thank you so much for joining us and sharing your expertise and your lived wisdom. We do hope to make more interesting and informative episodes in the future, so please stick around, join us. And once again, thank you so much. Take care.